Hello guys, one more video here. In this video we're going to talk about the electrooculogram or electrooculography or EOG. This is an electrophysiology exam that measures the resting electrical potential between the cornea and the Bruch's membrane. For this technique, pairs of electrodes are placed above and below the eye to the left and right side. If the eye moves from the center position towards one of the electrodes, this electrode sees the positive side of the retina, and the opposite electrode sees the negative side of the retina. Thereby, a potential difference occurs between both electrodes. The eye acts as a dipole in which the anterior pole is positive and the posterior pole is negative. About the indication, EOG evaluates abnormalities of the outer layer of the retina, for example, retinal pigment epithelium, allowing early diagnosis of some inherited retinal conditions, for example, Best disease. In summary, the EOG is used to evaluate the function of the retinal pigment epithelium. Some of the main indications of EOG are Best disease, adult vitelliform disease, any conditions that affect the retinal pigment epithelium, pattern dystrophy, fundus flavimaculatus, and retinal trauma. A relative flat line on EOG represents an unchanging voltage from the dark to the light phase of the exam, resulting in an ordinal ratio close to 1. The absence of light peak is a characteristic sign of Best disease. The ordinal ratio, which is the result of the EOG unity, the ratio of light peak to dark, is used to determine the normalcy of the results. Ordinal ratio of 1.8 or greater is normal. 1.6 to 1.8 is subnormal, and lower than 1.6 is abnormal. In conclusions, in specific circumstances, EOG is a very useful tool in diagnosing hereditary macular diseases. It is often applied in the confirmation of Best disease. Comprehension of disease states that affect the EOG make it easier to interpret the results. In conjunction with ERG, EOG is a useful test in detecting and following progressive retinal disorders.